breast lift is an operation we do to actually lift the breast up. In essence, a woman's skin envelope is greater than the amount of breast tissue within it. As a result of that, the breast sags, it hangs, it droops. So when we lift the breast, we're taking out excess skin, reshaping, recontouring the breast so it's perkier, is lifted up, and looks more natural. The way it was before a woman, say for example, had children. Breast lifting is an outpatient procedure that we do under IV sedation, so there's no pain at all associated with it, and the operation takes an hour and a half to 2 hours, and then the patient goes to the recovery room. They remain in recovery room for maybe another hour, hour and a half, and they go home. And basically what I tell patients for the first 3 or 4 days post-op is lay low, no heavy lifting or straining, and sort of take a mini vacation and just take it easy, catch up on your reading, and enjoy your next 3 or 4 days. The scars after a breast lift involve usually an incision around the areolar complex and then sort of an inverted T. Some people have described it as a lollipop incision. And I always tell people, when you have a breast lift, ask yourself, why is it necessary to do this type of an incision? And the reason is we have to reshape the skin envelope. The problem with a ptotic or sagging breast is there's more skin relative to the volume of breast tissue. So we have to recontour, reshape the skin envelope. And that of necessity requires making incisions. Usually the final scars will be an incision around the areolar complex and then the inverted T or the lollipop. How long will a breast lift last? It's a very common question after any cosmetic procedure. And I always tell patients very simply, it depends on the quality of skin at the time you do the lift. For example, if you were to take a new rubber band right out of the box and you were to stretch it, it snaps right back. Now you take that rubber band and you age it. In the case of a breast, for example, when a woman gets pregnant, her breasts enlarge, the skin envelope stretches, the elastic bands in the skin break, and so there's no recoil, there's no elasticity. We've lost that. So a lot depends on the quality of the skin at the time you do a lift. The more stretch marks, the more aged the skin is, the less longevity there is. And I always tell patients, you may need to come back in 2, 3, 4, 5 years to have it retightened. But the good news is you can retighten it. And it's not like you don't get a second chance.